Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about a pyogenic granuloma. A pyogenic granuloma is a swelling that grows on the skin and the mucous membrane, and it is usually as a result of the overgrowth of the small blood vessels, and it is usually not a result of cancer. Pyogenic granulomas usually result from repeated, long-standing minor injury to the skin and the mucous membrane. But in rare cases, they can result from infection of the wounds by bacteria, specifically the Staphylococcus aureus. The repeated, long-standing minor injury to the skin and the mucous membrane, as well as, in rare cases, infection by bacteria, for example, Staphylococcus aureus, can result into the formation of an unhealthy granulation tissue in that area that has been affected, especially if the patient had a wound and then the wound got infected, or that wound continuously got injured for a long period of time. Granulation tissue, by the way, is new tissue that forms on the surface of the wound to cover the gap that was left when the person was injured. So the body responds by creating new tissue and new blood vessels to fill that gap. And that new tissue and the blood vessels that are formed are what we call the granulation tissue. Normally, the granulation tissue should be flat. It should just cover that gap where the tissues initially were lost. However, in the context of the pyogenic granuloma, the tissue that will be formed to cover the gap where the injury occurred will not be flat. In fact, it will pop out, it will swell through the wound, it will spill over the wound, and it will form a swelling outside the wound margins. The sites of the body that are commonly affected by the pyogenic granuloma include the lips, the tongue, the gums, the nose, the fingers, the toes, the face, and the scalp. The individuals that are commonly affected by the pyogenic granulomas include pregnant women, women that are using oral contraceptive pills, individuals that sustained injuries and unfortunately got wound infection, individuals that sustained wounds on their skin or the mucous membrane, but unfortunately these wounds continuously got injured for a prolonged period of time, individuals with poor oral hygiene, individuals that are using certain drugs, for example, anti-cancer drugs, antiretroviral drugs, retinoids, or immunosuppressants. So how do you know that you have a pyogenic granuloma? What are the signs and symptoms that you should look out for to know that you have a pyogenic granuloma? A pyogenic granuloma usually starts as a fleshy lump, more like ground beef, and it protrudes through a wound on the skin or the mucous membrane. It usually grows very fast. It can start with a few millimeters and it can grow to around the tip of a finger. This fast growth can actually make an individual think they have cancer, but they don't actually have cancer. So if you're in doubt, please come to the hospital so that we can easily diagnose the pyogenic granuloma and we can also do treatment. It is usually red, pink, reddish brown, or purple in color. The pyogenic granuloma can be attached to your skin via a stalk, but sometimes it can just be attached directly to your body, the affected area. In the beginning, the surface of the pyogenic granuloma is usually smooth, but as time goes on, it can become rough and sometimes covered by a crust. The pyogenic granulomas are usually delicate swellings, and once you touch them or once you slightly injure them, they'll crack or they'll start bleeding. Actually, bleeding is a telltale sign of the pyogenic granuloma. Remember that these swellings are usually overgrowths of small blood vessels. That's why when you touch them slightly or when you injure them slightly, they tend to bleed. And that is a major presentation of the pyogenic granuloma. The diagnosis of the pyogenic granuloma is essentially clinical. So we do history taking and clinical examination. During history taking, we find out if the individual falls into the category of the individuals that are commonly affected that I talked about earlier. And in the clinical examination, we look out for the features that I talked about earlier of the signs and symptoms of the pyogenic granuloma. However, we can also do histopathology, where we take off a sample of the pyogenic granuloma and we can look at it under the microscope. This can help confirm the diagnosis, but it can also help us rule out a possibility of cancer. When it comes to the treatment of the pyogenic granuloma, we can employ some topical medications, creams that we apply on the pyogenic granuloma, and they can help shrink it. For example, silver nitrate, trichloroacetic acid, and imicrimod skin cream. We can also do a procedure called surgical excision. In this context, we cut away the pyogenic granuloma together with the surrounding skin and mucous membrane, which is 0.5 centimeters away from the pyogenic granuloma. After the excision, we can now suture the wound edges such that the gap that is left is closed off. By the way, in pregnant women, the pyogenic granuloma usually resolves after delivery of the child. However, if there are any other triggers that are present, for example, consistent trauma or use of certain drugs, for example, retinoids, these should be stopped, except if they serve a major purpose, for example, the ARVs and the anti-cancer medications. For the pyogenic granulomas on the eyes, we usually recommend eye drops, for example, the timolol eye drops. When it comes to the prevention of the pyogenic granulomas, please avoid the drugs that I talked about earlier, for example, retinoids. However, the drugs that serve major purposes, for example, ARVs, anti-cancer drugs, these should not be discontinued. Please also avoid trauma to your body. And if you ever sustain any trauma on your body, please show up to the hospital such that the wounds can be cleaned. Because remember that the pyogenic granulomas can also come as a result of wound infection. And when you come to the hospital, the wounds can get cleaned such that you don't get wound infection. And if they are deep wounds, let them be sutured. And to avoid infection from entering into the already cleaned wounds, please make sure that the wounds are dressed with a sterile dressing, because remember that bacteria can come from the outside, from the environment, and infect the wound. Or you can also touch dirty surfaces and you can touch the wounds if they are not closed. So when the wounds are closed, they stand a lower risk of infection by bacteria from the outside. And this dressing should stay on until the stitches have been removed, and the wound should continue to be dressed until after a month from the time you sustained these injuries. The wound will heal better that way because the dressing will prevent the germs from entering your wound. And remember, infection can cause the pyogenic granuloma. Please also exercise good oral hygiene. This means you have to brush every after a meal. You can also use floss wires or floss sticks. Thank Thank you so much for watching. Please share my videos and also subscribe. See you in my next video. Bye.